What are 5 similarities between pelvic floor physical therapy and regular physical therapy? Let's go through them. Similarity 1. We all focus on strengthening. It's important to have strong muscles inside the pelvis as well as outside the pelvis. Remember, the pelvic floor muscle is attached to the pelvic bone, so it's important to have strong muscles on the outside of the pelvis, like the hip muscles and the low abdominal muscles, as well as the pelvic muscles. So it's important to strengthen everything in order to have a stable core and pelvis. Similarity 2. We focus on stretching. It's important to have good flexibility and mobility in the pelvis. If you have tight hips, if you have a tight low back, it's going to affect the pelvis. So it's important to stretch and maintain flexibility. Similarity 3. We use a lot of the same equipment. We use stretching straps to stretch out the legs and the hips and the low back. We also use exercise bands, strengthening bands, elastic bands to strengthen the muscles. We use a lot of different things like weights. We also use internal weights. That's very different, but in essence, we still use strengthening equipment to strengthen the muscles. Similarity 4. We work on function. So maybe for working with a pelvic floor physical therapist, we're working on decreasing pain while you're transitioning from sit to stand, or maybe lifting without pelvic pain. Could be lifting weights, could be lifting a basket off the floor, or your baby off the floor, or a box off the floor. We work on functionally getting you to where you need to be. And similarity 5, we rehab you with your goals in mind. Maybe your goal is pain-free intercourse. Maybe your goal is running without pain in your pelvis. So we make sure we take your goals in mind and we rehab you with those goals in mind. So there are a lot of differences, but a lot of similarities between regular physical therapy and pelvic floor physical therapy.